laid it down here.
Okay.
I think that I don't saw the
The most
face.
important thing is this thing does not touch anything, because this is going to be connected to her. Once you remove this plastic thing, it's going to be connected to the drainage, to the tube that she has. So this needs to stay sterile.
Okay.
This part doesn't. This is very crucial.
So that white part right
Exactly. You're not removing the plastic tube. You're sterile, but the bottle, you can't just put it anywhere.
Right.
Okay?
So when we take that out of the bag, we have to rest it somewhere.
Right.
Okay.
That's why right now this is a bit of a
Hard.
yeah, not ideal.
Or can we not rest it, but when we are ready to insert that in there, then we'll just open it and then just insert it?
We can. Okay, so
let me
sterile.
open this up.
Okay, sterile.
So this is sterile pad right here.
Right.
So, I'm
So
gonna
the
open it and
inside of this, you're not touching with your hands. You're just touching the outer part of the paper.
Got it.
Because otherwise, you're contaminated. Even if your hands are clean.
Got it.
You're touching the outside.
Only
of
the
it.
outside like
Yes.
this. So nothing, I can't touch it inside
No,
at all. Okay.
you're not touching the inside until you have sterile gloves.
Got it.
And then you have sterile gloves, you can touch the inside.
Right.
But what if you touch outside and you touch back
Right, then
inside?
you're contaminated. You can't touch it again. Then you broke your sterile field.
Got it.
Oh, so once you put in the glove, you
This
you
is
cannot
a
touch
sterile
anything.
procedure. Right.
You cannot touch anything.
Right.
Okay. So I'm not
Okay.
touching
Anything.
I'm not touching that.
No,
Yeah.
you're not touching
Okay.
that.
So should I wear gloves? I can wear the
You
I
can
wear
wear
the
gloves.
purple
Now
glove
you're
right
gonna
now.
you're gonna put
Put that gloves on.
Okay, so here let's go over what you're doing next. So once you put on your sterile gloves, do you know how to put sterile gloves on? You do. Okay.
Yeah, I think
Then
I
you're
know.
gonna open that packet. That packet should have the stopper that goes into the drainage system once you're done.
Mm-hmm.
It should have
Gauge.
the gauze,
Yeah.
and there's also a blue
Yeah,
stopper thingy.
yeah, that goes right there.
Where
The clamp.
the clamp.
Yeah.
That clamp is only for emergency basis.
Oh.
If someone cuts it or it gets dislodged and you're getting a lot of blood, that's when you use that blue thing. Otherwise, it's just for emergency.
So
You don't normally use it. No. Okay.
All right.
So and then this is what's
This is a
gonna.
tape.
This is the
tape.
tegaderm, which is gonna go over this. So that also should be there.
In there.
And dump it. Don't touch. Okay. Now put on your sterile gloves.
By the wrist.
What?
Think about the wrist. The glove.
Yeah.
One by one. Don't do both. You do your strong dominant hand first, and you touch the outer part with one hand. Try not to use. Yeah. Don't do that. You're contaminating the outside.
I see.
You just put your hand inside.
Mhm.
Once you have the other glove, you're gonna fix it.
Got it.
Oh, that was the stopper.
Wow, it was in here.
Yeah.
That is not good.
So
Glad
two-
it went into the sterile.
Open up.
Glad
Another
it
one.
did.
Oh, went to the sterile.
Okay,
It was
now-
inside the glove. Wow.
That's terrible.
That's terrible.
Usually it comes in a separate package.
So now it's sterile. So
This is
I
sterile. You can
touch.
pick up that. Yeah. Now, Julie, you're gonna remove the gown because your sister is sterile. And you
Okay.
don't want her to do
Okay,
that.
so let me put on some gloves also. I only wash my hands.
You washed your hands.
Yes, I did one before I came in.
Wow.
Okay.
Wow.
Now, don't touch anything, Julie. Lee.
No. Okay. So I just.
Julie's gonna remove. Normally, if you're by yourself, you're gonna be doing this first. You're gonna remove. She's gonna remove the dressing for you.
If I'm by myself,
Then you have to
I have
remove
to.
the dressing.
Then
have to
you,
clean the side.
you remove this first.
Yeah. Clean the side.
Okay, so we moved all this.
Yes. I can do it for you very gently. Do you want me to do it? I use alcohol to remove it
Oh,
easy.
really? Okay.
Oh, maybe.
No, you can't touch
I
this.
can't touch
Then Denise can touch it. Don't
So,
touch this.
so if it comes off, then I can just remove it. Otherwise, use alcohol.
So this blue stopper is only for emergencies, okay?
Okay.
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 It's looking good.
It's looking
That's
good.
good. We don't have to clean until after.
No,
we-
you can.
we-
We
We can
clean
clean.
it with the rubber.
You want to clean it now?
Yeah.
Okay, so I have to go get another.
I have it.
Because they only give us 3.
What? This?
In here.
In there, they give us 3.
Oh, okay.
So
no
we save
worries.
it.
We have it, but
Okay.
that's okay.
So clean it.
Yeah.
Okay.
We can do it at the end. We can do it now. It makes no difference.
So we can clean now and at the end.
This side. In this side. Okay, got it. So if no one's
So this,
here,
if you're by
that's
yourself,
what we're gonna do first.
Do this first.
Before we put the
Yeah.
glove on.
Right.
Yeah. Do all this first. Prepare.
okay. So now we're gonna get this.
That's good.
Yes. So this is. Okay. So now this is what you're gonna be doing next.
Got it.
You have to clean that with the alcohol.
All right.
Yeah.
So should I go ahead and
Okay. What do you think you're doing next?
what I need to do is open up the alcohol pads, all three. Get ready.
Okay.
Okay.
And then what?
And then next thing, then I have to take one of those alcohol pads, actually open up the tip of that and clean
Okay.
clean the tip of
Okay.
that. Okay. So
Okay.
we should do that.
You can do that. Here, I got it for you.
So she removed
So
it.
you are now touching. So this, you're gonna have one hand. The dominant hand is gonna be touching that, and the other one's gonna remain sterile.
Okay.
Okay. So that means if you're touching that, you're no longer sterile in that hand. You
Got it.
understand?
Got
So
it.
with you're
So
right-handed.
I'm right-handed, so I need to keep this.
So
sterile.
this one is gonna right. So
Okay.
you're gonna clean.
So I can touch it with this one.
Yeah.
Okay.
And then you have to remove that first.
Okay.
Now, she remove it or do I remove it?
No. Well, one person is gonna do it.
But I
so
can't touch that anymore.
So she's not allowed to touch to open it. Wait, no, no. Oh, yeah.
I can't see it. Okay, now this fell, so we're gonna use another one.
Another
And
one.
this is gonna be trash anyway.
Yeah, trash. Because give us another one.
Do you still have it? The other stuff?
Yeah, if it fell onto
No, it
the.
fell onto the sterile film,
yeah.
so it's good. Okay, you don't try to. Yeah,
Only
just the
once?
outside.
Just the outside.
No, and you go for at least 10 seconds. Did you count?
Yeah.
Let's do it again.
Wait for this and just rub.
What?
Oh, I'm just telling you.
Okay, 10 seconds.
You counted?
Yeah.
Okay. So now what are we doing?
Okay. Then we open it.
Okay, hang on.
Oh wait. Okay. Yeah.
Don't
You already open it. Don't touch it. Now
So
you have
everything
to.
here in your sterile stuff is ready to go, right?
Right.
Okay, so now what we're doing is we're gonna connect it, but first, okay, we're gonna have to remove this paper. I can do that, and you're gonna remove the plastic. That white plastic thing is gonna go in there.
Right.
Now you're gonna clamp it. Is that your clamp?
That's the old
That's,
That's the old
So
stopper.
there's a new map
Yeah,
right there.
that's the old stopper.
okay. You're gonna before you connect it, you're gonna clamp this,
Oh yeah, close it.
and then you close it
To the closed position.
And I told you before, you want to go slow because once you poke the bottle, it's gonna gush.
Right.
It's gonna come out
So
fast.
go really slow.
So you want to go slow. So you're gonna clamp it and unclamp it slowly. You're gonna clamp it, put it in, and then unclamp it. Good? Okay. So
Okay.
what are we doing?
So
I'll remove this part, but we're gonna.
yeah, I
So
can't
once
touch
you
Yeah.
clear and you're gonna have a sterile field, this needs to stay sterile. You understand that, right? Because it's going into the tubing.
it. Right.
So this is the crucial part here.
So I can't hold it with this.
So we need to figure out a way that you have a
Wow.
better.
Yeah.
So
access
maybe
to this thing.
so we can do that before we
Before
can,
and leave
yeah.
it on a sterile field so then she can
So it's
do
ready,
all these
yeah.
maneuvers and
Exactly.
Yeah.
spike
So
it.
remove the paper
Right.
and then remove the clamp there.
Yeah,
Yeah, already.
So
And
all
then-
Yeah.
the prep have to be
Okay.
but then that has to rest on a sterile
So
field. That's what she's
I'm
saying.
clamping
You're
it.
clamping it now.
Oh, closing
clamping
it.
it
Okay,
now.
so you are closing it.
You're gonna remove the plastic thingy here. I can do it because that's
Yeah.
you can do it with your sterile hand.
Okay.
And now you're gonna do this because I'm not sterile. You are.
Well, you have to remove. You have to.
Hang
Yeah.
on, I know.
Okay.
So I have to remove this plastic.
But this one doesn't have a paper.
Yeah. Yeah.
It's hang on.
Yeah. It's right there.
Yeah. The plastic thing.
Yeah. You have.
Okay.
Yeah.
So, but if once we do this,
Mm-hmm.
Oh well, you know what? Actually, you still have to puncture.
Hang on.
Okay.
Yeah, of course you have to puncture. But once you puncture, I want this to be first and
Ah.
this to be second,
I see.
and then clamped and then go. But
Okay.
I want to make sure that she can do it by herself.
Okay.
So this thing needs to come off.
Mhm.
Okay.
Okay.
So that had to come off, and then what?
Then this comes off.
Comes off.
This goes.
I can
and
remove this.
That's
Yeah.
n-
right?
hang on. That's
No, sorry.
Wait.
Okay. let's do this.
Mhm.
Once, if you're on by yourself,
Mhm.
once you connect it,
Mhm.
it's gonna come out.
Right.
If this is not connected, where is it going?
That's
It's
right.
gonna bleed. So you wanna make sure your drainage system is ready.
Right.
So you're gonna puncture here,
Mhm.
and this is gonna be closed, and then you're gonna puncture. Okay.
So everything's closed,
This is closed. This is
Closed.
not closed yet. I haven't done it
but
yet.
this is closed, so
Yeah,
it
this
won't
is
go
clamped.
in.
This
Yeah.
is clamped.
So it's clamped. It's closed. It's still
Right,
closed,
right.
correct?
Right.
Okay. So we're good for me to push.
So now
No.
I'm gonna do this, and then you're gonna do that. You're removing
I'm
it,
removing that and
and putting
insert
it there. Yeah.
Yeah.
And I'm gonna put this in here.
So you tell me when.
Okay.
Ready?
And
Oh.
then
It's kind of sticky. Whoa.
you are the sterile one. You have to do it.
Yeah.
You just
Pull it. I think you just pull it.
Yeah.
Whoa. Really, really.
Okay. Make sure the other touch the other,
Maybe you
Tube.
want to hold on to
Do
the
you want
tube
me
so
to
she
hold-
doesn't.
but it's
wing-
sterile. It's
yeah,
clean.
To this is clean.
Yeah.
Okay.
Yeah, that's been clean.
So she doesn't yank it
Oh.
accidentally.
Is it hard?
There you go.
Yeah, yeah.
Okay.
It just used force.
Okay. Now remember.
Okay.
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 Now
So-
it's clamped. We're gonna.
Is it
this
closed?
is done. This is now. We're gonna open. You're gonna control it very slowly.
Oh, is this now sterile still?
Now you're no longer sterile.
I'm no longer sterile. Oh, I see what you're controlling slowly.
So she'll have to be still up until the point where she connect this thing.
And that's
Well,
what-
first you have to create the
Yeah.
vacuum over there. That's why you have
you
to
did push it in. Yeah? Okay.
spike it, and then you spike the tube.
Like all the way.
It's all the way.
Is it pinching?
It's in an open position.
It's supposed to be all
Wait,
the way.
okay. And is it in open position?
Oh, there we are. There we are. Now it's in. Then we're rolling that. There we are. There we go.
Okay,
Or you go all the way. Or...
I see
It
what you're
didn't-
saying.
yeah.
So now I'm
So
okay.
now I'm not gonna do it. I'm not gonna open all the way. I want it to go slow. You can give it 15 minutes. It's okay. You
yeah.
don't have to do it within
Yeah,
one
do it
because
slow.
it's causing her to lose a lot of fluid.
Yeah.
So slow is better.
I see.
I see. Okay, she is.
Yeah, very slow. That's good. Go slow. And you see the color? It's
Yeah.
like amber. So now we know. Close that
That's
Click
the
that.
key, right?
and then puncture. And we hear the click.
But the thing is, you need to do it by yourself.
Yes, yes. So the important thing is don't touch
You have to
anything.
be still. Yeah. Keep one of your hand.
Hand not touching.
Just prepare your
Yeah.
field.
Just
first.
prepare
Like
the
she
field.
said, you
And then
really
we should
need
be
that
good.
table over
Okay.
here.
Yeah, I think that's what we'll do next.
Mhm.
We're gonna figure it out. Bring that table over here.
Mhm.
Open everything and put it on,
Yeah.
including this.
Yeah, because this table is useful because we used for the food too, to feed her.
So the G2.
Yeah, for the G2.
Yeah.
We stand here to give her food.
Oh.
No, but then
But it's bolus. It doesn't take very long. right?
bolus only need a little space where this
Yeah,
needs a
yeah, yeah,
lot.
yeah, yeah.
So
maybe we
between
can
the two
figure something, yeah.
procedure, that table
Yeah.
is more useful over here.
Yeah, that's true. Okay,
And
then
you're
you have
only
to
gonna do it every couple of days, so you can
clear it
clean
for that.
move back
for
and forth
5
and
minutes.
move it back.
Okay.
Yeah.
Yeah,
And before you put your sterile field, you clean the table first, then you put your sterile field.
I
Got
see.
it.
Okay.
Because the sterile, you understand why, right?
Yeah.
You want to prevent infection.
Right.
Bacteria loves opening in the skin.
Yes.
Anything that they can go in, they do. So if you're introducing, because we are not clean,
Right.
then we are introducing.
And
bacteria.
this podcast can be like 10, 15, 20 minutes
It can, and
because we just go slow.
right,
And
I
as
mean,
long as it's still going,
right.
right? I see.
Hers is pretty slow. In the patients I've used, had
Go
they were
really
gushing a lot faster than she is. So
Okay, good.
yeah.
Yeah, so see, when I walked Julie through the procedure, we did open up everything.
Okay.
See, number 4, 5, 6,
Mhm.
8. Before
Right.
9 is when we actually inserted.
Okay.
So actually can do all of that 1 to 8
You can do that
before we put in the gloves
Mhm.
even.
Oh, you did
I can-
this before?
Well, no, I'm just saying can we do that? Like my glove,
Uh-huh.
because I'm not touching this yet.
Right.
I can do all that with the other glove, get it all ready. Then I put on this glove and only deal with this and this at the last minute, like between.
Yeah, I mean, I hear what you're saying.
Yeah.
Usually, you don't deal with this unless you're sterile.
Okay.
But like I said, the bottom doesn't need to be the only part that
It's
needs to
this.
be.
It's
that
really
one.
this
Yeah,
one.
yeah,
That's
it's really
right.
that one.
So I guess if I'm completely honest with you, we just want to get to this being sterile.
Yeah.
If we do 1, 2, 3 or 3, 4, you know,
Yeah.
the order,
Yeah.
it's okay. If you want to do it your way, if that's gonna be working better for you, that's fine.
Yeah,
You need to be
probably.
comfortable.
Yeah,
You
because
just,
we're not used to the sterile
Right.
part, so we may do it, and we may touch something, not knowing, realizing that we are
Right, I understand.
contaminating.
Okay, as long as
Don't touch this or
Right.
that.
as long as
Just
you
don't
don't
touch this.
that.
We can touch the outside bottle.
Right. On
Yeah.
the
So basically,
bottom.
we can touch everything
Mhm.
except for that part.
For that part.
Right.
Yeah.
Okay.
So maybe to be safer,
Right.
we do all that first, and then you don't want to have a maximum.
I don't have
Oh,
any
No,
maximum.
not
I,
yet.
I see. It's
Yeah, I
like
see.
on a low.
She's pretty slow. I've had people before where I just even like here and it was,
Oh.
but
Okay.
hers is pretty slow. So this rate is good because if I went slower, it would stop it.
Yeah.
See,
To
if I go
stop,
like
you go
this,
all the
I'd
way
stop,
down.
and I don't want to
Yeah.
do that.
Yeah.
Yeah,
And
and this you know how to use this, right? The control.
Mhm.
It's very.
Yeah.
Yeah.
But you see, if I moved it lower, then it would just stop the rate.
Yeah. Oh, and then the clamp. Oh,
Yeah.
we left the. So is it clamp or not clamp?
No, it's not clamped.
It's
If
not
it was
clamped.
clamped, it wouldn't come up.
If it, you have to use your hand to clamp it.
Oh,
Right.
okay.
Right.
In the normal, not touching it, it's not doing anything. It's not
No,
clamping.
it's not supposed. No, you sometimes there's a different clamp for like the G tube.
Yeah.
There are clamps like that.
Got it.
Some systems are a bit different.
Okay.
So sometimes there's a clamp where you need to open it. Hers
I
was
see.
not like
I
that.
see.
No.
Yeah, because they give us another. Because the last time we would just told to just remove the clamp and then just put in a new clamp. at the
Right.
end.
Sometimes they have the same clamp that they have for the G tube here, and
Yeah.
you have to open, otherwise nothing would come out.
Yeah, yeah.
So it's
Yeah. This
different
Is just,
equipment.
yeah.
Okay.
Okay.
Mm-hmm.
You feel
It's
confident?
dripping. Yes.
Yeah.
Yeah.
Yeah, we can even open more because
It's okay.
she's pretty.
If she
slow.
starts coughing, then we need to.
Yeah.
calm
Well,
down.
yeah. That's our key. When she start coughing, then
Right.
we just.
And
It's,
disposing
Kinda
of this, you know, only
They told us to just put it in the regular trash. That's what they told us.
you flush it in the toilet.
Oh. They didn't tell
Oh,
us that.
yeah. They didn't tell us that.
Because they asked me who trained, and I said it was the home health. Oh, they're
Oh,
no,
okay. Yeah. Now we have to stop.
Okay.
Yeah.
Stop.
Yeah, because then she
It
got,
stops.
Yeah. Because then she.
now she had more air,
Because
so she
it
kind
hurts.
of coughed.
And you can stop and give it a 2 minutes
Yeah.
and then start again. But this, think about what you're putting in the trash.
Yeah, exactly.
Yeah.
It's a biohazard.
I asked them,
Because-
and then they said just put it in
Yeah,
the
and
trash.
I didn't meet them because Julie was here when
Yeah.
this home health came.
You
Yeah.
flush it in the toilet.
Yeah, they can once
Yeah.
to do it.
When we got back
Should I
from the
try
procedure.
again?
I think no, mom, no. Yeah, because usually when she started coughing, and then she said it
It
hurts. It hurts on her chest.
Are you okay?
Yeah,
It hurts.
yeah. She said it hurts.
Hurt a little
It
bit.
hurts?
Hurt.
Yeah.
You want to know no
We
more?
could almost
Well,
like
we
kind
don't
of-
have to get all of it, right?
Well, it's better if we do. I can try just opening
Yes,
a little bit. If
that's
she
See a
right.
coughs,
little
Yeah.
bit.
Uh-huh.
Let's
I
see.
Try.
haven't done. That's a little
Okay,
bit.
try a little bit. Try a little bit more.
You okay?
Okay.
So it
okay,
was
okay.
the home health that
No, it
Was
does not go in the
assigned.
trash.
Yeah. Yeah, they told me to just throw
You
in the
okay,
regular
Mrs. Sue? You're doing
Okay.
wonderful.
yeah, nothing's
Okay,
coming
okay,
right now.
good.
Yeah, she's
You
doing
okay?
really good.
Mm.
Oh, there's a little bit more.
You okay? Oh,
It
yeah.
hurts.
Yeah, now she's beginning to.
You know how one
to
day
say it hurts. Right?
it's still dripping a little.
Oh, yeah.
What did you say?
She said when she coughed, it hurts her lung a lot.
Okay.
Yeah, she said it hurts.
It hurts.
How much pain is she in
Đau nhiều
Oscar?
không? Từ
Đau
1
nhiều
tới
không?
10.
Đau bao nhiêu?
Đau mấy? Number mấy?
7. She said 7.
7. Okay.
Well, unless she coughs, I won't stop it.
Yeah. She coughs again.
Yeah, it's where we were before. So we're like 3/4.
Okay.
There's a new clamp. There's a new
Yeah. Mhm.
right here that
Right.
just accidentally fell in there.
Yeah. Oh, good.
That
it was
like,
inside the glove.
Yeah.
I've
Otherwise,
never
we have
seen
to
it
get a
done.
new one.
Right.
Otherwise, we have
Yes.
to get a new
Otherwise,
one.
you have
It was
to
in
new
between the
one.
two gloves. Amazing.
That's terrible. Usually they pack it separately in the
Exactly.
packet.
Exactly. So when I pull up the one glove, already like halfway put in my glove, that's when it
That
fell
was
off.
lucky that it fell in there.
Mm.
So now we know we have to do everything on
Exactly.
top of the sterile pad.
Exactly.
Okay.
Okay, I think we need it.
Yeah.
Okay.
We got that pretty good.
Okay. Okay.
So let's see the number.
Yeah, and then we record it.
Okay.
It's
So
like-
now what are you doing, Lee?
Okay, so we close that, and we supposed to pull this out, but and then take that and close it.
Right.
That's it, right? Okay, so I should just pull it now out.
Just take. Sorry.
Yes.
I would think that just have it in your hand.
Okay, yeah, I can do that.
Okay, we're all done.
There you go.
And we don't care about that anymore. We just close this up.
It's
Okay.
easier that way instead of having
Oh.
because otherwise then again you have to
Yeah.
clean
And
it
it
because it's gonna touch.
And it
touch. Yeah.
Okay.
Okay.
Then
How much?
It's about close to 500. Like
Okay, 500. This is the 500, right?
475.
475.
475 cc. Can you write it
Yeah,
down?
this is
Okay.
dark amber. Yeah. So to open this, you know how to do it. You
No,
open
we never
okay,
did it because
so
we
we'll do
always trash
so
it.
we
it. So we're gonna do we can do that and then dump this. Okay.
so we close her up
So
now.
first
Take
of
her
all,
up.
what are we doing?
So we have to bandage her back up.
You
We already cleaned her,
Right.
so we
can clean it again. There's
Okay,
no
let's clean it again.
here.
Okay, we can clean it again.
Nothing's
I'm
gonna.
sterile. I'm okay now, right? With touching
Right now,
everything.
you're no longer sterile.
Don't need to worry about it.
No. The sterile part is
Over.
concerning this,
And that's it.
Okay, the sterile part is putting the two together. Correct. That's the sterile part.
Right.
So this is going inside.
Right. That's like the G tube thingy.
Yeah.
And now you're gonna coil the tube.
She okay? Yeah, her coughing's not coil.
Right. Put the gauze on.
I have a new clamp, but we just leave it.
You don't need to
You,
change.
you don't need to change. Nothing happens to it.
Okay. Yeah, exactly. I'll just put this pad over,
Right.
like so,
And now the
and then I need
Tegaderm.
Open this.
Yeah. You know how to use it. It just goes from the.
Yeah, it's sticky.
It's sticky.
Yes, it's really sticky. Very good.
Yeah, I've seen it used like bigger ones. This is just Tegaderm. So you just do this. You're gonna. This is the sticky part, and this is gonna come off once you put it. So make sure that this is in the center. Okay. So if I remove everything, it's gonna stick to whatever you're doing. So let's do it when you're closer to her. Okay. This comes off, and the paper is gonna come off too.
Yeah.
It just peels. You okay, Mrs. P? Okay, peel the paper. Hang on. Uh-oh.
It's okay.
That's okay, that's fine. And this is also gonna peel.
Oh, we kind of missed the center.
As long as it's covered, it doesn't have to be perfect.
Okay.
And then this is
You
also
okay?
gonna come
You
off.
okay, Mom? Oh, spit. You need to spit. Spit. Oh,
Make sure it's
where's the thing?
covering.
Just give her the
You want to create a good seal,
napkin. Yeah, napkin. Yeah.
okay?
It will.
Here you go.
Yeah.
Okay, we need to do it one more time.
It's on the side here.
You're doing good.
It's a lot. It's a lot.
Okay, so now we're gonna
See,
go.
I was gonna. So we could have just prepped and opened all these up when
Yeah,
it
you
was.
could, but I gave you mine.
I know.
You
It's
have
good.
extra
We have
now.
help.
You have
today.
extra now. So when are you doing it again? Okay, because Denise is gonna come this week and do it with you.
Yeah,
again.
exactly.
So today is Tuesday.
Yeah,
Thursday.
Friday.
Wednesday.
Friday.
I don't work
Wednesday,
Friday, so I work on
Thursday.
Thursday.
So Thursday. Thursday. So we do it Thursday. Then we have to do it Friday, Saturday, Sunday.
Saturday.
We don't have to do it Saturday, Thursday because it's 3 times a week.
We can do it Thursday next, and then after
Thursday
that, it should
and
be
then
Saturday.
Saturday I'm on call. Okay.
Or we can be ourselves on Saturday.
Okay, no, that's okay.
Yeah, we like to have
I'm
training.
on call, then I'm on call.
Yeah.
Okay, this, let me get rid of it. So we're gonna go dump this in the toilet. Now you're gonna, it's just, you remove this part.
Yeah, you have to show us how to open it.
Trust me. You can write apps. This is not brain surgery.
Of course. I'm just very gentle because I don't want anything to break. Because that's happened a lot of the stuff. It breaks. And, oh, no, you can't. You don't have to part.
Okay. So you don't want to open anything until you get there because this is full of bacteria, okay?
And we call the you have to open this.
You want to lift the seat
Put the seat.
and you're gonna toss the trash after I'm done, right?
Oh, you don't
We will.
We can do this. Yeah. You can pull this part.
I thought it's all in one piece.
Hang on.
That's why they tell us to throw it away.
Yeah, they told you throw away.
Maybe yours is different than what
Yeah.
I'm used to.
Oh, but then the instruction did say to dump it. But then I crossed out and she said throw away.
Yeah, no, she told us.
Because she told us to throw away.
Yeah, your instructions are to throw it away.
Maybe your equipment is a bit
You know what? Because
different.
if you're taking that,
Yeah.
you're gonna have a
It's
spike.
sealed,
It's
yeah,
it's
yeah.
So you can't. So we're throwing it away.
So I guess it's a
Oh,
different
it's
one than what
vacuum,
I'm
huh?
used to.
It's vacuum.
It's vacuum.
Yeah.
Okay. It's
The
different.
ones I've
Yeah.
dealt with, you open.
You open. Okay.
So if I put
Different
in the
brand.
trash, you make sure. Yeah, I don't want
Yeah,
to
no,
be
we'll
in,
put it in the bag.
a biohazard bag or.
Yeah.